Good afternoon, everyone. I'm Cook County Commissioner Donna Miller, and welcome to our program. We're going to give it about a minute or two to let Facebook join the program live. And if any of you are on who are watching, you can share this on your personal page and start your own watch party, which we would really appreciate. So we'll be going live in about 2 minutes. So please join the page. Let us know you're here by saying hello in the comments, and we'll get started shortly. Good afternoon. We're just going to give it another minute or so before we get started. And just keep in mind as the audience builds that this program will be housed where you can see it later as well on my page, the page you're watching this from. So if you're able to share today, that would be great. It builds the bigger audience and casts a wider net. But you can always view this program at a later time as well. So as the audience builds, I just want to thank you all for joining us here today. We'll get started in just a minute. And please say hello. I see someone said hello already. Thank you, Elmer, for joining us today. It's great to be here. I want to welcome you all to our program. This conversation is part of my lunch series with the experts, and I'm so glad that we have a great group of people here today from Be the Match. We're going to be discussing how you can safely join a life-saving donor registry. We'll hear more about Be the Match from the great panel experts that we have here today. And we're also here from, I don't know if we're going to still have the transplant recipient mom who's looking for a match from her 8-year-old son. But I just want to let you all know who is here with us today. We have a great panel, and we have Dr. James LaBelle, who's from University of Chicago, who's in pediatrics and hematology and oncology, and is the director of the Hematoma Poetic, I can't even say that, stem cell transplantation program. Dr. LaBelle, thanks for being here.
Thank you,
also have Gift. Thank you. We also have Gift Matimba Mustafa. I'll pronounce it right again. Be the Match. You are the Senior Director of Sales and Marketing from Be the Match. We also have Lamikia Davis from the Be the Match Recruitment Center, who is a community engagement specialist. We also have two brave patients here today who are going to share their stories. One is on with us right this moment, and we'll hear from him in a little bit. But Michael Hansen Jr., thank you for being here. And we'll have great to hear from you in just a little bit. And we'll also hear from Natalia Torres, who is the mother of the 8-year-old Alfredo Diaz, who's in need of a stem transplant and currently has no matching donor. So you might not know what that means right now, but we will help you understand what that means, why we're all here. And I will turn the program over to Lamikia.
Good afternoon, everyone. Thank you all so much, Commissioner. Thank you for having us today. I really appreciate you allowing us the platform. I have my boss, and then I have a doctor here, and we're going to talk about some great things on this morning. And so just to get us started, Dr. LaBelle, we're going to ask you what is, actually, before we get to that, I am going to show a video really quickly just to introduce you all about what we got going on today. So we're going to have a video.
Please make this cancer go away. They're gonna take the blood out of me, and they're gonna put it in a magic machine to make it the medicine, and then they're gonna put it back in my body. It's gonna make me feel better.
That's our prayer, right?
Yeah. Please,
Our hope and
God,
prayer.
make me feel better. Make this cancer go away.
Yes, you can be a cure for that young lady and so many others. We're going to go ahead into the program, and I'm going to ask Gift, what is Be the Match? Tell us about Be the Match.
Yes, Lanika. Yeah, again, thank you so much, Commissioner Miller. Thank you for this great opportunity to give Be the Match an opportunity to share about what we do. So Be the Match is really a nonprofit organization that was founded just over 30 years ago. And basically what we do is we facilitate stem cell transplants, right? So what people, many people suffer from all sorts of blood disorders like leukemia, lymphoma, and sickle cell disease. And unfortunately, with sickle cell disease, as many of you know, it disproportionately plagues communities of color, in particular Black African-American communities. So what we do is this stem cell transplant is another form of treatment for those conditions, in particular for sickle cell disease. And the unfortunate thing today is that when you think about stem cells, only about 30% of the people will find a match within their family. So 70%, most people do not have a match inside their family as far as a relative. So they actually need somebody, an unrelated donor to get their transplant. So what we do at Be the Match is we operate the largest registry in the world, and particularly here in America, where we ask people to join the registry who will go on to donate when asked. And those folks volunteer and donate them stem cells in order to save the lives of many people. That's essentially what we do in a nutshell.
Awesome. Thank you. Dr. LaBelle, I have a question for you. What is a stem cell transplant? What are you transplanting exactly? And what diseases are treated by stem cell transplants?
It's a great question, Lamika. I want to also thank Commissioner Miller. Thank you so much. I'm as I was watching Ilani speak about getting a transplant and speaking with you and being with you, I'm humbled to be here. Growing up in Park Forest, I'm from the South Side of Chicago, so I am very humbled to be here. A transplant really is exactly what we're taking the bad bone marrow. So bone marrow in everyone's body produces things like white blood cells. It produces red blood cells in the context of things like sickle cell disease, as you were referring to earlier. Or if you have a leukemia or a cancer, and leukemias are cancers of the bone marrow. And we, in essence, give that patient medicine to clear out the bone marrow, the diseased bone marrow. And then we take bone marrow from another person from Be the Match, most often actually, from these registries. And we put it inside the patient. And it sounds quite dramatic, but really, it's really just, if someone has ever seen someone get a blood transfusion before, we hook up the bag of stem cells that have been collected from the donor, and we put them in someone's body just as you would a blood transfusion. So you're sitting at the bedside, and there's an IV or there's a line in your bloodstream, and the stem cells are dripped in. And the stem cells are smart, and they know exactly where to go. And they go to their home, and their home is in the bone marrow of the patient. and they start making babies. And those babies are new immune system, new red blood cells, and new platelets, and all the things that a normal bone marrow has. And they repopulate that person. And our goal, of course, is to get rid of all the diseased marrow and to provide that person with a normal functioning immune system for the rest of their life.
Pretty awesome. So you mean to tell me that it isn't like donating an organ or something like that?
In fact, it's a life-saving organ, but it's not like donating a liver or a kidney or having an operation to actually remove part of that organ and then having another operation to put it in the bone marrow. It turns out that we have bone marrow in all of our bones in our body, all of them. They're easily seen if someone were to actually have a steak or something like that. You can see the marrow in the bone. Well, imagine that bone being in someone's leg, their femur, and that's exactly what it looks like. And the nice thing about bone marrow is that we can get rid of it with chemotherapy or certain medications without having to do operations. So when we actually transplant the bone marrow, we don't need to actually physically go into the patient's bones to inject the new bone marrow. It goes in your bloodstream and they know exactly where to go.
Wow, that's awesome. Thank you so much. So Gift, do all patients have an equal chance of finding a match on the registry?
Unfortunately not, Lamikia. And this is the thing, when you think about what wakes me up every day is knowing that that's not the case. So today, if you're a Caucasian, you have a 77% chance. So 3 out of 4 Caucasians will have a match on the registry that happen to fall ill. But unfortunately for Black people, right, African Americans, Black people, it's only 23%. So it's 1 out of 4. So it's a huge disparity. And if you think of the other ethnicities, they fall somewhere in between. So Asians, it's like 41%, Hispanics, 46%, Native Americans, 57%, and so on. And if you're mixed race, even less than 23%. So this is one of the major focuses we have in our organization. This is what keeps me up at night, is how do we close this disparity? And so that's the most unfortunate part of this story today. But there's hope, and I think there are a lot of things that we're doing at Be the Match to address that disparity. And that starts with building awareness, education, and making sure more people of color, more Black people in particular, because of this disparity, are aware of this disparity. And when people find out, they want to do something about it. And that's how we close that gap.
Awesome, thank you. So you said, why do you suppose there is only a 4% chance for someone who is African American of finding a match? Why do you think so, Gift?
Right, so there's actually a 23% chance, right? But and the reason is because if you look at the registry, while Black people make up about 15% of the U.S. population, there's only 4% of us on that registry. Mm-hmm. And so there are a couple of factors. One, I would say awareness, right? So, by and large, when we've done the research, about 6% of Black people compared to 12% of white people are even familiar with Be the Match and this whole stem cell transplants and how we can actually save lives through this. So building that awareness and making sure people are aware, that's number one. People have to first know about it and know that there's a disparity, and here's what I can actually do about it. Which, again, thank you, Commissioner Miller. This is one of those forums, an opportunity to raise awareness. The second issue is that even once we've actually started to communicate and educate, we have the historical mistrust of health institutions in America, right? We talk about some of these things are systemic. Some of it is historical with the Tuskegee experiments, the Henrietta Lacks. There's some medical abuses that have happened throughout the history of this country. And some of those things are still happening today. There are disparities in the healthcare system today. So that tends to make it more challenging to get Black people in particular and people of color to participate in terms of the process here because of fear of how my cells might be used and so on. So a lot of that, we're addressing through education, but it's that awareness, the education, and making sure people are aware that, unfortunately, with this particular disparity, it'll take us Black people to save another Black person, because you're most likely to match with somebody who shares your ethnicity. That's the thing with this disease. So we need more Black people in the registry, certainly more than the 15% that is the percentage of Black people in this country, to help address that gap.
So you're basically saying someone who looks like you is who we need to help save our lives.
That is correct. That is correct. Somebody who, exactly. So the matches are typically by ethnicities where we find the match. So a Black person is more likely to help save another Black person, a white person, another white person. So because we are underrepresented on that registry, there's less chances of finding a match. And also, the last thing I'll say, we know that Black people, we have a lot more genetic diversity, right? So our genes are more diverse. So it is harder to match. So we actually need more representation than even the 15% that we represent as far as the population of this country.
Got it. Thank you so much. So there are a couple ways to actually donate. Doctor, can you tell us about how the donation process?
Sure. There's in essence nowadays in when transplants were first starting, there was only really one way to donate, and that was actually to bring a patient or a donor to the hospital and actually collect the bone marrow from their bones. And you generally collect the bone marrow from one of your biggest and most exposed bones, which is your hip, the back of your hips here. And that was really the only way to do it. And then in the mid 90s, we began to understand a little bit more about how we could donate things, these stem cells from the bone marrow, using growth factors that we would give medicine to donors. And then we could actually collect these stem cells just from your bloodstream. So we didn't actually need to bring patients to the hospital or the operating room to collect the bone marrow. So really there's actually three ways ultimately, but there's two ways that are mostly used. And one is collecting the bone marrow directly from the donor by bringing the patient to the hospital. You get anesthesia, so you don't feel anything. And we take needles and we just collect the bone marrow from the back of your hips here. Generally, those patients leave the hospital right afterwards. They don't stay in the hospital. We do this many times from children, in fact, and we send them home with a little bit of Tylenol and they're fine. The other way to donate stem cells is to receive that growth factor we call it mobilize. So we take those stem cells and we give them a signal that says, hey, wait a second, get out of the bone marrow, come into your bloodstream so we can collect you. And then what we do is we put a large IV in a donor and we just collect the blood and we put the blood back and we take the stem cells. And then those cells are then frozen, and then we can thaw them and give them to a patient later on.
Wow.
The third way really, which is not a lot of patients use this way, but sometimes we can actually take even blood from umbilical cords from patients who are born and use those as stem cells. Those are used less often, but that is an option.
Wow, that's pretty impressive. So for some of us who may be afraid of needles, can you tell me, does that shot hurt? Is it like a shot or what? What does it look like?
It's funny, the shot for the growth factor, it's actually very well tolerated. It's funny you say that because we work with children. I'm a primary pediatric and young adult physician, so I transplant young people, and I don't know of a young person who likes needles, but I've never had a patient or I've never had a donor not be okay with it afterwards. It's actually quite a very small needle when you give yourself the growth factor, and it's very well tolerated.
Got it. All right. So for those of you who want to know what the process looked like, we're going to take you into a video right now of a young lady who actually matched someone, and this is her process. Her name is Lauren.
One of the main reasons I did decide to join the registry is because the lack of African American representation on the registry. It's our responsibility to register because, you know, a lot of times we're given the shorthand in life period, but this is something that we can control. Just like voting, you can do this. I think I was at happy hour. And I got a call about the registry, and I was like, what? So I was kind of freaking out because I saw this episode of House, and I saw that episode where the guy had to give bone marrow to his brother, and he was sick too, so he couldn't go under anesthesia, so it was just traumatic. I was like, sheesh. But, you know, come to find out, there's 2 different ways to donate. Everyone was like really supportive, and they were like, you know, oh, that's so amazing. Like, so it made me feel even better about my decision.
She's excited, of course, but she's like, okay, what happens now? And from that point, then that's where we begin to order filgrastim, prepare for the injections, and then we just wait for that date to arrive, and then first injection.
My Be The Match specialist, Chelsea, gave me my first injections. She taught me how to teach my friend to do it. You know, it hurt a little bit because I was nervous, Shelby was nervous, so, you know, we had a little shakiness going on.
It took us like 20 minutes to like settle down and actually like, okay, we're gonna get through this. We're gonna do it. We had to play some music, get hype. Like, okay, we can do this, we can get through it.
The injections hurt like a normal shot, but taking off those like super strength band-aids probably was the worst part because I have hair on the back of my arm and I don't know, I just can't rip it off. It's stuff that's kind of like, get over yourself, it's not that big of a deal. So there's really nothing, like I have nothing to complain about.
I think she saw the big picture, like she's saving someone's life, and nothing was gonna stop her from saving that kid's life. You know, she made it through anything, Band-Aids and all, like.
The person I'm donating to is a 1-year-old boy. He's probably seen more needles in his life than I ever have. I just don't see how me, a 21-year-old grown woman, could just act so scared when he's so brave. So that's just what I think about, and I just get over it. Think about if it was your child. Think about if it was your sister. Like, you don't let fear be the only reason that you don't help someone or save a life.
I mean, I can say a lot for her because I've had donors who came here and did the whole process and then sent me a text and said I can't do it. So for Lauren to be her full of personality but do what she said she was going to do, I can respect that and I can handle that.
When you are called and you decide that, oh, no, I don't want to do this anymore, that's another like little girl, little boy, grown boy that is heartbroken. Your life is just as important as theirs, and your life isn't the one that's in jeopardy. The only thing that is going to be going on with you is some inconvenience, and that's okay, because that's life. But in the long run, you're helping somebody, and I feel like that should be the most important thing to you.
And she's gonna save a little boy's life, and I think that's very heartwarming and it's inspiring. Like, she makes me want to go get on the registry, and she's gonna remember this for the rest of her life. I'm gonna remember this for the rest of my life.
I just want him to know that there is someone out there that looks like him, that it was able and willing to donate their blood stem cells so he could fulfill the life that he was supposed to fulfill. And I just hope that he grows, he eats all his vegetables, he gets all A's, like me. And he's just happy, and I hope one day down the line, I'm able to meet him, and I'm able to thank him for making me a better person.
So that is the process, or that's what it looks like. And in fact, you do match someone. Dr. LaBelle, I just had one more quick question. Can you tell me, is there a such thing as a good or a bad donor?
Sort of. We will take almost any donor because it's so difficult. It's so phenomenally difficult to find matches, particularly, as Gift was saying, for African patients or Black African American patients, and or other different minorities. However, there's some data to suggest that the younger the donor is, the better the donor is. And so generally that cutoff is around 44, 45 years of age. Donors less than that generally have more bone marrow to offer. So it's a little easier to collect. But that's not to say that we won't use bone marrow from older patients as well. In fact, we do oftentimes. But there's some data to suggest that sometimes one is better than the other.
Got it. Thank you so much, Doctor. The commissioner may have some more questions. Commissioner, you take the floor. Thank you for allowing me to ask questions this morning or this afternoon.
This is
okay.
So enlightening, and love to know how easy things were. So I just wanted to ask about the registry in general. So Lamikia and Gift, if you could just tell us, how do you join the registry?
Yes, thank you for that. And as a matter of fact, it's a really simple process, and many of you will know, specifically related to this. It starts with just texting. In this case, we've got District 6 saves, I think is the code. So if you would just text District 6 saves all together, no space. So districts, the number 6 saves to 61474, and I'll repeat. Text District 6 saves to 61474. And what you'll do when you do that, it'll launch a link, which when you click on that link, it'll be a process that takes about 7 minutes, I would argue, where you're asking for some of your information. And then from there, we will mail, you will receive a kit, a swab, essentially a kit
like
that has
this?
Exactly. Oh, you wanna go ahead and
Sure, I made sure I had an envelope. So
Okay.
once you text that code to 61474 in the mail, you'll receive this envelope, right? So you will open the envelope and it looks like this. So inside of this envelope, you have 2 swabs. You swab right cheek for like 3 to 5 seconds. And then with the other one, you're going to swab the left cheek for 3 to 5 seconds. And then you're going to place it right back in here. And then you put it on the little sticky. Make sure it sticks to there. Close it up. Back in the envelope. And guess what? We pay for postage. So you just drop it in the mailbox and it comes back to us. And then we'll determine it goes to... Did someone say something? I'm sorry. Oh, no. Then once you drop it in the mail, it goes to Be the Match. And then that department will determine if you are a match or not. And there is only a 1 in 430 chance that you will match. So the chances are very slim, which is why we ask for the community to put the word out there. We need as many people as possible to join the registry, because once you do join, there is a slim chance of you even matching one of the patients. We have a couple of patients that we have on today. Commissioner, if you wanted to introduce them, you can. It's your word. I don't want to take over your show. This is your thing. I don't want to keep going.
Well, yeah, I just wanted to finish. So is there an age requirement for the to be in the registry?
So today, our age requirement, I think like Dr. Lavelle just shared, is 18 to 44. So you must be 18 to join the registry. And if you're over 44 today, the process is actually a little different, where they'll ask you to pay $100. And that's only for people who are over 44 years old. But we really need those folks specifically who are ages 18 to 44. And that's the age group. And there you don't have to pay a thing. You just go through that text that I mentioned, you'll swab, mail it in, and that's the end of the process.
Well, that sounds super easy. It does sound simple. And thanks for sharing the numbers that it takes to be a match. And then once you find out if you're matched, then what happens?
So yes, so typically the process, and Dr. LaBelle, you can certainly chime in here, but the way the process works, you'll be contacted if you're a match by Be the Match. And what they'll do is the first step is just actually sending you a kit to essentially do what we call confirmatory typing swab. So you'll swab again, and then they'll make sure they match exactly. It's another confirmation that you really are a match. Then you'll go through some of those steps that Dr. LaBelle mentioned. So there's a physical exam. You'll get this drug called filgrastim, right, to get your body to produce more stem cells. And then before you actually go in for the procedure to donate. And so again, Dr. LaBelle, if you want to add to that any further in terms of the process, but the two different ways you join, one is called the peripheral blood stem cell, which is basically like giving blood platelets. And that's the one that 4 out of 5 people typically are going through that process. But 20% of the people will go through what Dr. LaBelle talked about, where they will extract it from the bone in your hip. So that's for 20% of the people. And then he talked about recovery. I won't repeat that. But essentially, there's a step. That's the step-by-step process we use.
Yeah, that's exactly right, Commissioner. One thing I'll tell you from our standpoint, when we have a patient who is in need of a transplant, how it works on our end. And in fact, we have no relationship and don't even know who the donor is. I think that's one important thing to bring up. Donating can sometimes be, although a great life-changing event for the donor, it's the ultimate source of giving, but sometimes it can be emotionally charged, right? Because you're actually providing your stem cells for someone in need. And so there are stops between the patient and the physician for that patient, and actually finding that person in the registry. In fact, when I see a patient in the hospital, let's say, who needs a bone marrow transplant, I tell our coordinators, and our coordinators go to the registry and they see if there are any potential donors. I am not aware of who that person is, what that person, where they're from, or anything like that. It's completely divorced from the patient. And in fact, the donor is not aware of who the patient is either up front, which is an important thing to remember as well. And then, just like Gift said, that person is then asked to come in just to confirm things are correct, and they match appropriately. And one question that comes up often with me is, what does matching even mean? What does that mean? Because although patients, donors and recipients look a lot different. So what are you matching? And it turns out that we're matching for a particular protein, and cells make proteins. Each one of our cells makes about 30,000 proteins, but we're only looking at one particular protein, and it's called HLA. And that HLA really defines our immune systems. And it turns out that you get some of these proteins from your mom, and you get some of these proteins from your dad. And so that's why it becomes very, very difficult to match folks. And there's only a 1 in, I think, Lamika, you said 430 some odd chance that you're going to match, because we all come from different places, and our family, if your family tree is like my family tree, it's like a family bush. It sort of just kind of goes like this. And so it's hard to match people. And so what we do is we don't look at all the genes of the donor. We just look at that protein, and that genetic information is not shared with anyone, nor is it tied to any sort of database with someone's name or anything like that. It's very, very secure. And that's another question that comes up often when we talk about matching.
That's a great point as well.
Explanation. Thank you so much. That helps. Yeah. So, okay, I do know that we have two guests here with us who are going to talk to us about their personal experience. First, we'll hear from Natalia. Natalia, if you don't mind coming on and introducing yourself and tell us about your son and how this is so important to your family so that Alfredo would be able to receive a match and get transplant that he needs. So you want to just take a minute to talk about your story? And thanks so much for being here with us.
Thank you for inviting me, and I am Natalia Torres. My son is Alfredo Diaz. He's 8-year-old. He has been suffering from this rare blood disorder, which is called IL-10 receptor deficiency. Since he was newborn, he had a fever of 103. He was 1 week old, and we took him to the closest hospital. Then we were transferred to Lurie Children, here in Chicago, downtown. We spent 4 months in the NICU trying to see what was going on with my poor son, which was not interested in eating, which was having fevers, continuously fevers that wouldn't go away. He wouldn't be able to eat. He had inflammation in his intestines. Later in time, in 2015, more tests were done, and then that was when we found out about this illness that he has. In the summer of 2015, the doctors recommended a stem cell transplant, which was coming from umbilical cord. They said it was a 50% chance that it would work and a 50% chance that it wouldn't work. And I was really optimistic that it would work on him. Unfortunately, it didn't. It didn't graft. Those cells from a known person, the umbilical cord, didn't work for him. And that was really devastating for us. He still is in a delicate situation with his health. This illness affects his intestines. He has a great inflammation that doesn't let him grow, doesn't let him gain any weight. He's 8 years old. He has a weight of 52 pounds, almost 4 feet tall. And this is because of an injection that we started giving him. To help him with the inflammation that he suffers on his colon, to give his colon a break. And since 2019, I decided to step up and do more for him, meaning contacting someone in Be the Match to help us share our story and raise awareness with the Hispanic community, because he needs a matching donor from a Hispanic ethnicity. And for us, we have not found one. And the doctors have told us that we need to find it, but that donor is not on the data or in the registry data. So when I hear those words, I feel like I'm going to lose my son. And the fear of losing him has made me step up to contact Be the Match and tell them, hey, I need a team. I need someone to help me out. I need to tell my story. I'm shy, but I'm willing to do everything to save my son. And knowing that there might be someone out there that could be the one matching my son, it's giving me hope to continue. These 8 years have been tough on him. He's depending on medicines to control the inflammation, to suppress his immune system, to keep him stable in a way. But we know that these are just little bandages, a bridge, until we find our stem cell donor that will be the cure for this illness that he has. He has a central line on his chest. He depends on TPN nutrition fluid overnight for 12 hours. He depends on nutrition that goes through his G-tube, medicine that goes through his G-tube. He takes 7 medicines daily, twice a day through the G-tube. And now with the ostomy that he's been having for 2 years already, it helps his colon get a break from all the inflammation. But it hasn't been easy, and still having the ostomy does not completely cure him. And it just breaks my heart that we haven't found one matching donor. And because we're Hispanics, we barely register. We're not aware of need. We're afraid of a needle. We're afraid that we might not have the healthcare insurance, that we are maybe immigrants. We're afraid of maybe donating something, some cells that is, we're just afraid, and we don't know. We don't have the accurate information, and which I also ask possible donors to ask questions. If you don't know, and if you're afraid, to clear those questions out and decide to donate, because that could mean saving my son's life. And for him to live more years, for him to continue thriving and growing and have a better future, a better quality of life for him.
Thank you, Natalia. I really appreciate you sharing your story and Alfredo's story. How is he doing?
As of right now, we're in the hospital. He had an emergency Friday night. He had procedure on Friday, a dentist procedure. They removed his baby teeth, 6 baby teeth out, because they were blocking a row of permanent teeth in the back. So we decided it was time for him for those teeth to be removed, together with a colonoscopy, upper endoscopy that was done. He had some complications right after. A little hole in the intestines where letting the air out to another part of his body, together with bacteria. He has pneumonia, some signs of pneumonia. They've been doing many X-rays on him, and right now he's in pain. This is the second time that he has to go through an emergency operation, and he's on morphine to control the pain.
Wow.
But the inflammation is still there. It hasn't gone away. It's still there. We're trying to figure out other treatments to treat this inflammation, and other medicines that have not been tried in other patients, because this is a rare illness. So basically, there's no medicine that will help control the illness that he has.
Thank you, Natalia. So this is just giving us even more reason to get the awareness out there and for people to join the registry, because we are fighting for Alfredo. Thank you so much for joining us today.
I appreciate the time, and I'm also always willing to tell my story and to encourage others to donate. Same for African Americans and Hispanic, because we need it. We need it in our community. Thank you.
Thank you so much, and thank you. That says a lot about your dedication with you being there in the hospital and joining us today. So thank you so much.
Thank you.
Commissioner.
Yes, Natalia, thanks for sharing your story, and thanks for being brave enough to come on and speak with us today. And we'll definitely keep you and your son in our prayers. And I think that you told such a compelling story that anyone who hears this will feel maybe the need to help. So thank you for putting it out there in that really powerful way that only a mom can do, really. So thank you so much. It is. So next, we do want to hear from Michael Hanson Jr. And Michael, please introduce yourself and tell us why you're here today.
Thank you, Commissioner Miller, for having me. Thank you, Lamikia, for inviting me, and thanks, Doctor and Gift as well for having me. I would like to say a happy Women's History Month to all these dedicated women out here doing hard work to, really save lives and spread the word and awareness in the community. Thanks, Natalia, for your story. You're so courageous and strong for that, and I'm rooting for you guys. Your son's strength is going to come from your courageousness. So I appreciate you telling your story today. So a little bit about me. Yeah, I was born with sickle cell anemia. I was diagnosed at 7 months old. And when I was a kid, like I was telling the commissioner previously, almost like clockwork, every 3 to 4 months, I'm in the hospital, needing a transfusion. My hemoglobin would drop severely low. Had all types of illnesses, acute chest syndrome, mpox, pneumonias. Even at the age of 6, I had a stroke, believe it or not, because my blood levels got so low that they transfused me. But, they had to get more than 1 unit, and I guess it was just a little too much. So I had a stroke at the age of 6. I had a gallbladder. I had my gallbladder removed when I was in the 7th grade. I missed like half the school year because I had to have surgery and was very ill. So as a child, it was very rough for me. Couldn't have a normal childhood. Couldn't really hang out with friends. Missed a lot of school. Couldn't play sports. I'm a huge sports fan. Couldn't really play sports and stuff like that. So as I got older, well, back in the 90s, they started me. I was one of the first patients in the whole country that they did the trial version of hydroxyurea on. Like I was one of the first when they did the trial on, and that was, a little bit of promising to help treat sickle cell. It wasn't a cure, but it helped treat it. So as I got older, I wasn't as sickly or as in the hospital as often. And then, but it was still rough, even with me. Like I say, I'm here with the kids, they're e-learning. So if you see me turn around or whatever, I'm here with the kids. My wife, throughout our marriage, I would be sick a lot. So it's not like when I, get sick, like I take 1 day and, be okay and go back to work. Sometimes I'll be off for weeks and months. So, a lot of people don't talk about the financial struggles that we deal with as well. For my wife to have to carry the burden for a long time, even my family try to help out. It gets very stressful. And so I want to say back in 2014, I went to I go to the University of Illinois, Chicago, and they were trying to do a stem cell transplant. They say, hey, we think you're a good candidate for this new transplant. It's showing promising to curing sickle cell. And they were like, well, do you have any siblings? And I'm like, yeah, I have 4 siblings. My older sister, she has the trait. Then I have another sister who's, I call her my twin because we both had a disease. She has the disease like me. Then I have a younger brother who's actually a captain in the Army now, and he's a police officer in Hodgkins. He has the trait. And then my baby brother actually is normal. He doesn't have any diseases, any traits or anything like that. So they thought he would be a good, like, okay, well, let's try him and see what we can do. So we went through the whole screening process. He's a match. And I was one of the fortunate ones, like I said, because it's very rare, to find that match, in the household, especially, like I say, since all my other siblings have, traces of the trait and the disease. For my younger brother, baby brother, have nothing. And to be a perfect match is just like miraculous. So that was nothing but God. So yeah, we was trying to do that in 2014, but he was in the military. So we're just tough logistics trying to work everything out. So 2018 is when I had my transplant. And during that time, like I say, they had to prep him. They had to boost up his stem cells. And like I say, it's just like dialysis, they put an IV in, suck out the blood and they, filter out the stem cells and they, filter the blood back in him and everything. And that took like about, just a few hours, and they was able to get the stem cells. And I won't forget, May, they had registered for the hospital. And in April of that year, because I was a little nervous. It's a scary process, to go through that. I had to have chemo, had to have radiation, and all that, as the doctors explained. But in April, like a month before I was registered to go, for my stem cell transplant, I had a very bad sickle cell crisis. I was in the hospital. I was on morphine drip. I was there for a couple of weeks. And so that was like, okay, you know what, let me, that gave me the motivation and the courage, like, okay, let me just, because like I said, I have 3 kids and I'm like, I have to be around for them. I have to be here for them. So I'm like, let's do this. So during the process, like I say, they admit me in a hospital. I was there for about a month and a half, almost 2 months. Had the chemo treatment, had the radiation treatment. And, I was able to get the, had a central line put in my chest. And it's funny because my birthday is June 19th and I was in the hospital on my birthday, getting treatment and everything like that. So, it's just, you have a new look of life, from being in a hospital, having chemo on your birthday, to now being, 2-3 years removed, now being fully healthy and normal. But like I said, it's just, I thank you for this opportunity and this platform to share my story because it is rare. I was one of the fortunate ones. But, the medicine has improved so much from even the last 20, 30 years. Like I say, I started hydroxyurea back in the 90s, and that was just a treatment. Now we have a cure. To think now that sickle cell is a curable disease, as well as some of these cancers and other blood disorders is curable now through the power of stem cells and power of donations and finding matches. And that's what the real, purpose of, I feel like, I'm a Christian and I believe, Christ came not for his life, but for to help other people's lives. And that's what I feel like my purpose is. Like, I feel like God sends you through stuff so you can help bring people out of it. You see what I'm saying? So I'm just, grateful that I was fortunate enough to have experienced that and overcome that, and to now use this opportunity to help tell people like, hey, there's this treatment. Let's see if we can find matches. And now this stuff is curable. So other people can have the same type of success story, the same type of, cure, from dealing with a life of pain and suffering from these horrible diseases. So, I just thank you guys, like I say, for having me here. And, I just, really want to let people know that, it can be done. You can be not just, you can be the next Michael or whoever, you can be cured, to have faith, keep praying, hold your head up, but also to spread the word. Like I say, sometimes you might find a cousin. Sometimes it might just be a neighbor next door that you don't talk to regularly. That could be a match for something or someone. So just spread the word and getting that out there can help, save a lot of people's lives. And I thank you for letting me tell my story. And hopefully, someone hears this and feels the need to like, okay, let me go sign up. Let me go see what I can do to help these people out.
Michael, thank you so much for telling that compelling story. I mean, you can tell it comes straight from your heart, and it means so much for you to be able to share it and be a blessing to other people, as you mentioned. So thank you. Wow. So I don't know what to say except for whoever is listening out there, please share this vital information. We have Alfred Hospital right now, and he is in need of a donor. We need to get more people matched. And I just wanted to also add, see if Michael could also just tell us, after you received your transplant, what medication or what do you have to do as a result of receiving the transplant? Well, there's one little cutie. Hi.
Yeah, that's the baby. She's acting camera shy now. Yeah, so after the transplant, and that's another thing too, like I say, being a father, so after the transplant, because they completely wiped out your immune system, my T cells were low for quite a while. So I was on autoimmune medicines, I was on antiviral medicines, antifungi, some antibiotics. So I was on a lot of medication, and the doctors, because she was, a toddler at the time, about 1.5, 2. And so the doctor said, well, hey, because, and this was obviously pre-COVID, so kids were in school, they're around playing and everything. They was like, you know, you got to be mindful and be careful around, you know, children and people who are sick, and even pets. Like I have a dog now, even pets, because they can spread germs and stuff like that. And because my immune system was so low, it could be very harmful or serious. So, like I say, I was fortunate enough. I'm one of the blessed ones where my family picked it up and let me, you know, I was able to stay with my parents for a while until I, you know, gained a little bit of strength and everything. But the recovery was about a year or about a year and a half, because I had to follow with the doctors like weekly, get lab work, constantly. Like even before COVID, I had to, if I leave the house, I had to wear a mask. I had to be very cautious because, you know, I didn't have much resistance with my immune system. So I was actually away from my kids for about 5 to 6 months, and that was honestly the hardest part. Like even going through the chemo, the radiation and stuff like that. The hardest part was being away from the kids for that long, because you know, Daddy had to do this so I can be there for them in the future. So like I say, that was the hard part. And then you know, I was on this medicine called sirolimus, and I had to take that let's say about 3 times a day, and that was just to make sure that my body, because I had so many blood transfusions in the past, that I had a lot of antibodies. So I was on sirolimus to make sure that my body don't build up antibodies to resist my brother, who was donor's stem cells. So I was on that for a while, and then they slowly weaned me off once they, you know, found like the numbers and you know, the levels were normalizing. So yeah, I would say that's about a year and a half that I took for recovery. And then even after that, I still had to get all my immunizations, all my shots. And like I say, follow-up, had to get breathing treatments to prevent pneumonia and stuff like that. So it was a process after the transplant. I'm sorry, as well. I was in the hospital for about 2 months for the transplant, and then afterwards about a year and a half for follow-up and treatment. And I'm still seeing my doctors now actually to follow up with certain things. But overall, like I say, it was worth it, though. It is worth it, because like I say, right now I'm fully sickle cell free, haven't had a crisis in, I don't know, about 3 years now. So you know, yeah, it's like I say, I'm fortunate to have a family to lean on, but I know there's some people that don't have that, and especially like I say with African Americans, you know, the financial and economic thing too, it's very costly. Medicine is costly, treatment is costly. So that's all things that you got to consider as well when you think about getting the stem cells, like the financial and economic aspect and how it affects the family as well. So that's why I think like programs like Be the Match and stuff like that is important, so we can get the ball rolling and help, you know, start these people on the process of curing.
You're right. That's just amazing. Well, thank you again for being here and that story. Natalia, you again for telling your story. Those stories are going to make the difference. So I want to thank you all, and I just want to give the leukemia gift, Dr. LaBelle. How about each one of you take a minute to close out and share some parting thoughts? Amikia?
I'll actually have Dr. LaBelle and Gift to go before me, and then I'll close it out, letting everyone know about tomorrow.
Sure, I can just say thank you so much for letting me be a part of this. And Natalia, your story, and Alfredo's in my thoughts and prayers, and Michael, your story of courage in going through this is really remarkable, and really we can do this as a team. Transplant is really a team, and when you come to the hospital or you need a transplant or you're interested in a transplant, you meet a lot of people and support staff to help you through this. And part of that support staff is Be the Match. And without Be the Match, we just couldn't do any of this. We couldn't affect anyone's life. And so I want to thank Lamikia and Gift for letting me be a part of this as well. It's not important. It's fundamental that we get people in the registry. It's critical. And I encourage everyone to do so. It's easy.
Yes, and also I want to thank Natalia and Alfredo. Your son is a trooper. Thank you for all that you're doing. I know there are a lot of people that have joined the registry because of your story. and we're still hopeful and continuing to work to add more Hispanic people on the registry to save him. There he is.
There's Alfredo back
there's
there.
Alfredo. He's a trooper. But thank you for your story. It's just so powerful, and it's just a reminder for all of us here. And I also want to, again, Michael, and what you've gone through there, and your brother, how he again has helped you and saved your life as well, extended your life. I really want to encourage everybody that's listening to, think about, Alfredo. Think about, Michael's, obviously in his case, his brother happened to match him, but most people, 70% don't have that match. So I just really encourage you to dig deep. I'm on the registry, and I'm still every day I'm looking for that call. I haven't been called, so it's a bummer. I know some people are being called, but I look forward to being called, and I hope that some of you will consider making that decision to join the registry. It costs us, the folks who are donating, nothing. And when you think about the impact you would make to a family like Natalia's family by being able to donate stem cells to him, it is so immense. And that's what humanity is all about, how we can help each other. Somebody needs stem cells. You can give the stem cell. There's really, your life is unchanged in that way. But most people we talk to, they become completely different people, and they're so grateful to have that opportunity to save someone's life. And they become like a second family, right? Seeing that person grow and experience life the way they should. Thank you, Commissioner.
Thank you, Gift. It's a pleasure to work with you. I'm actually with ICLA Da Silva Foundation, which is the largest recruitment center for Be The Match. So hello to all of the ICLA Da Silva family that are watching right now. Thank you, Natalia. Thank you, Alfredo. You all are in our prayers. Dr. LaBelle, thank you so much. Commissioner, I appreciate our relationship. Thank you so much. Michael, you are a rock star. Thank you. And with that being said, if you forgot to do it, please right now text District 6 SAVES to 61474. And if you're just someone who would like to speak to someone in person or ask more questions after today, tomorrow I will be at the Village of Park Forest Village Hall out in the parking lot. You can drive up and pull up in your car, ask the questions. You can actually receive one of these kits in hand on tomorrow morning from 10 a.m. to 1 p.m. That location is 350 Victory Drive in Park Forest. I'll be there tomorrow. I'll be able to answer any questions for you guys. Once again, thank you so much. We appreciate you. And I pray that you guys join us in the mission to save life.
Well, thank you all again for being here. Lamikia, thank you again for coming to us and bringing this vital information and making us aware so that we can share awareness with so many people. I've said before, I know the impact of sickle cell disease on a family because it impacted my family. My sister has sickle cell disease. I have sickle cell trait. And, it does impact the family on so many levels. So it's great to see Michael with his family and mentioning family support and talking about her family support, her son. And all of us need support from the community. This is what we can do as a community to help those in need. So Be The Match. Thank you. I appreciate your work. It's vital to help save lives. And I'm committed to help you. And I'm sure the word is going to get spread, and we're going to do our best. Thanks again, everybody, for today.
Thank you.
Thank you.
Thank you. Thank you for having me.
Bye.